Now we're going to take a look at 4 different ways that we protect the brain. The brain is really a soft organ. I'm told that in humans, it's more like a spongy jello. And so we really have to take care of it and make sure it's well protected. And we're going to do that in a few different ways. First, you've got your skull. So clearly your frontal, your parietal bone, your temporal bone, your sphenoid bone, your occipital bone, all of these bones and your ethmoid are all surrounding that skull and giving it a hard protective layer. That's the cranium. The second way that we protect the brain is through connective tissue that we call meninges or cranial meninges. There are 3 types of them. We've got the dura mater, the arachnoid mater, and the pia mater. They're dense. The dura mater is dense, irregular CT. And dura means tough, mater means mother, so in German, and so it literally means tough mother. This is the tough mother holding the protecting the brain. It may sound like another word, Darth Vader. Darth is dark, Vader is father in German, so the dark father, and then you got the tough mother here protecting the brain. That dura mater is actually in 2 different layers. We're going to have one that's right next to the bone, so we call that periosteal layer. And then we have one that's right next to the other meninges, so we call that the meningeal layer. Now right underneath the dura mater is going to be another layer called the arachnoid mater. This is much thinner, and it's going to have little spider-like projections that are going down into the pia mater. But between the dura mater and the arachnoid mater, we're going to have what's called the subdural space because it's underneath the dura. And in that subdural space, we're going to have basically interstitial fluid in there. Between the arachnoid and the pia mater, we're going to have a subarachnoid space. And it's this subarachnoid space that we're going to see in a few minutes, cerebrospinal fluid. But continuing on down, this arachnoid mater, I said it has web-like projections going down to the pia mater. The pia mater is basically, it's like saran wrap. It's really thin and translucent and makes the brain kind of look a little shiny. It's kind of vacuum packed on there so that in all these little nooks and crannies, that pia mater is going down and then it's going to right up on the bumps. So it's following these little bumps and crevices in the brain very, very closely. So those are the 3 layers. Now, if we go back to the dura mater, and we said it's got these 2 different layers on it. Well, those 2 different layers are, when they split, they're going to cause a little hole right here. And this hole is what you saw before in this section being the superior sagittal sinus. We're going to see a few different sinuses, and these are going to be draining blood from our brain. So let's take a look at those. Where those 2 sinuses came together, it made a little sheet that was coming down, a little vertical sheet. That sheet is called the falx cerebrum because it's a sheet between the 2 different hemispheres of our brain. The sheet is going down through what we call the longitudinal fissure. A fissure is like a really deep crack that's dividing 2 different regions together. So this one in the middle between the 2 hemispheres is the falx cerebrum. If you were to kind of follow this down, this little guy down here is the cerebellum. And although it's not a continuous falx or sheet, we can see that the cerebellum also has 2 hemispheres, and we're going to have this little dense irregular CT dividing those 2 hemispheres as well. So we're going to call that the falx cerebelli for cerebellum. And then we have one more that's dividing the hemispheres from the cerebellum, or the cerebrum from the cerebellum, and it kind of makes a little tent over the cerebellum. So we call this the tentorium cerebelli. So now we've got these 3 divisions between the hemispheres and the cerebellum, the falx cerebrum, the falx cerebelli, and the tentorium cerebelli. So now I think you have a greater appreciation for that falx cerebri because we had, remember, dura mater up here with the periosteal layer and the meningeal layer. That meningeal layer is making our falx cerebri. And you can see right here that's going to create a little tunnel. This is going to be called the superior sagittal sinus. So now I'm going to kind of fill in from before when we were trying to do the circulatory system and draining the blood from the brain. Well, I'd already shown you the superior sagittal sinus, so now I'm going to show you the rest of them. We can see if this is our falx cerebri here, the superior sagittal sinus would be running superior to that falx cerebri. Then we have what's actually an inferior sagittal sinus, which is going to be on the bottom of that falx cerebri. I'm going to bring up another picture so you can see it from complete anatomy perspective. Here's going to be that superior sagittal sinus. Then we've got an inferior sagittal sinus, but you notice it's going to stop up short. So it needs to get back to where everything else is draining. And so we got a straight little shot here going from the inferior sagittal sinus to where all these kind of meet together in what's called the confluence of sinuses. And that straight little shot is called the straight sinus. So they all meet in this confluence of sinuses. Then it's going to traverse around here horizontally, so we call that the transverse sinus. And then it's going to go through this little whoop-de-doop, kind of like a little S shape, so they call that sigmoid sinus. Anytime we have a S-shaped type thing, it's going to be called sigmoid. And then from here, it's going to drain into our internal jugular vein. Okay, so that takes care of 2. Now we're on number 3, cerebrospinal fluid. So you might remember these little guys from our last lecture, our ependymal cells, and we said that they're producing this cerebrospinal fluid. Well, they're kind of producing it. Where it's really coming from is the blood. And what we've got is we're going to have a collection of little blood vessels, little capillaries in the brain, and that's going to be called the choroid plexus. And these little capillaries are going to be leaking their fluid like capillaries do. And that interstitial fluid, it's going to be called interstitial fluid, but it's the plasma that's leaking out of here, is going to get absorbed by our ependymal cells. And those ependymal cells have really tight junctions between them. So they're going to be a barrier between any of this blood that's leaking out and what's going to be in the ventricle system out here and bathing the brain directly. So that plasma is going to leak out. It's going to have to go through these ependymal cells, kind of get filtered for and allow it to only allow things like glucose, oxygen, different proteins, and it's also going to absorb what the brain has been putting out, some of the toxins or the metabolic wastes from that brain. And it's going to be basically making this cerebrospinal fluid. It's going to have some leukocytes in it that will be able to fight infection that's leaking out around the brain. And there's only about 80 to 150 milliliters circulating in the whole central nervous system at any time. So it doesn't take a lot, but it's just a thin little layer of fluid, and that's going to help protect the brain. It's going to do a couple different things for our brain, which I'm going to show you in a minute. So anyway, all of this is called the choroid plexus, and we're going to see that in different ventricles. We've got lateral ventricles, a third ventricle, and a fourth ventricle, which I'm going to show you next, where this choroid plexus is taking place, and it's going to be making all of this fluid. Here's just kind of another little showing of a blood vessel making up part of our choroid plexus, and we've got those ependymal cells absorbing that fluid and then making our CSF. And here's a horizontal or a transverse cross-section of the brain, and you can see what are going to be these lateral ventricles, these big caverns in here where we've got choroid plexus. See this little dark area in here? That's the combination of all these little blood vessels, the choroid plexus and these lateral ventricles. It's making all this cerebrospinal fluid. It's going to be housed in these lateral ventricles and the rest of the ventricular system. So here we go. Now we've got a hemisphere, we've got our cerebellum. Now you can see this is a big lateral ventricle, and there's 2 of them. We don't name them right or left or number 1 and number 2. These are just the lateral ventricles. Then between the lateral ventricles, there's going to be a little tunnel here called the interventricular foramen. And that interventricular foramen is going to drain whatever's made in these lateral ventricles into what we call the third ventricle. And that third ventricle, you're going to learn later that we have these nuclei called thalamus, or thalami for plural. This third ventricle is going to be right in between the 2 thalami, which are kind of sitting in this space right in here. From that third ventricle, we're going to drain down through this big long tunnel or tube called the cerebral aqueduct, and that's going to go to another opening between the cerebellum and part of the brainstem you're going to learn as the pons. So this is the fourth ventricle. So now we have two lateral ventricles, an interventricular foramen, third ventricle, cerebral aqueduct, and the fourth ventricle. And from this fourth ventricle, we're going to allow this fluid to drain out. Some of it's going to come right down the middle of the spinal cord through what we call a central canal, a little teeny hole right in the middle of the cord that you've probably never even seen before. There's going to be other openings in this fourth ventricle here where the fluid can actually come out and surround the brain and surround the outside of the spinal cord. And we'll see that next. Before we do, though, let's just kind of say, well, why do we need the cerebral spinal fluid? Well, we need it for a couple things. One, I mentioned before, mechanical protection. So it actually acts as a shock absorber, this liquid, between the brain here, which is covered by the pia mater, and the arachnoid mater. So it's in that space, that subarachnoid space, but it's going to act as a little cushion for that. It's also going to provide some chemical protection, so it's keeping our ions in the fluid in check so that we don't get too acidic, too basic, and keep a good charge on the brain so that because too much of anything is going to cause the brain is very delicate as far as its homeostasis goes, so it has to be able to manage that well. And finally, circulation. So it's going to be where we have a lot of exchange of nutrients and metabolic wastes, and it's going to be kind of like cleaning up that plasma, just similar to the way that the lymphatic system does in the rest of the body. In fact, the cerebral spinal fluid is super important, and one of the reasons why I tell you guys to get sleep is because when your brain is working hard, you're making all these proteins, and those proteins become kind of like metabolic waste, and they can sit around and kind of clog up the systems up there. When you go to sleep, your cerebral spinal fluid washes away a lot of those proteins, and you may have heard of beta amyloid protein or tau protein that are associated with Alzheimer's. And people with Alzheimer's have a big buildup of this stuff. And they found that in other studies, when mice and then when people get more sleep, that those proteins actually get washed away. So there's some thought that you could reduce your chance of getting some types of dementia by getting more sleep. And that's kind of a long-term effect. Okay, so we've got our cerebral spinal fluid being made in the lateral ventricles, the third ventricle, and the fourth ventricle. That fluid is going to be going to the respective ventricles and then draining out lateral ventricles, interventricular foramina, third ventricle, cerebral aqueduct, fourth ventricle, then out through these different apertures and into the spinal cord, and that's what's going to bathe the brain. It'll eventually get reabsorbed by the arachnoid villi. So we've got these dural sinuses, right? The sagittal sinus, the superior sagittal, inferior sagittal. All those sinuses are actually going to be draining blood, and with that, they'll be pulling in some of that cerebral spinal fluid, so it'll get reabsorbed into our system. And here you can just see the side view of that. We got our different choroid plexuses in the lateral, the third, and the fourth ventricle. And you can see how this fluid is actually going out and surrounding the cerebellum, surrounding the brain from multiple regions, and it's also going to surround and bathe the spinal cord. So it's basically getting your entire central nervous system. Now there's a condition called hydrocephalus, and hydrocephalus is when we have an increased amount of cerebral spinal fluid pressure, and that can happen in two ways. One, which is probably the most common, is an obstruction, so that we don't get that, the fluid keeps getting produced, but it's not able to escape and get reabsorbed into the venous system. The other way is to have an abnormal amount of cerebral spinal fluid produced. So you're producing more than you can absorb. Sometimes we'll see this happening in little babies like this little guy here, and because their skull has not fused together, the increased pressure in their brain can actually cause those skull bones to separate a little bit and expand and take on some of the extra pressure. But that can be really dangerous because there's also pressure going internally on the brain as well, and that can cause some brain dysfunction. So what they can do is they'll actually take a little shunt. So you can see here the lateral ventricles are under a lot of pressure pushing against the brain there. They can put a little shunt, which is like a little tube, into that lateral ventricle, and that will drain the pressure, and it'll drain through a little tube that they'll wrap behind. This is all underneath the skin, behind the ear, and it actually goes into the abdominal cavity. I've treated many brain injury patients with this because the same thing can happen with a brain injury. If you get swelling in the brain and it basically closes off some of these pathways, then the brain isn't going to be able to drain that cerebrospinal fluid. So we do it manually, and you can actually see a little tube going right underneath the skin here, going down into the neck, and then you can't see it anymore, but it'll go into the abdomen, and it'll just drain into the abdomen, and there the fluids can get absorbed. So that is a ventricular peritoneal shunt, or most commonly called the VP shunt. Fourth way, this is the last one slide in this series, is looking at the different coverings of the brain, is our blood-brain flow and the blood-brain barrier. Blood-brain barrier is made up of a couple different sections. You may have heard me talking before about the importance of astrocytes, but we're going to start a little earlier than that. So the endothelial lining of blood vessels is really made up of these tight junctions. So it's going to really limit what can flow out and into the blood here. It's going to have a thicker basement membrane than what we see in other regions where we have continuous capillaries. So that's going to limit what can get out. And also we've got our astrocytes, and those astrocytes are going to be secreting chemicals, so they're going to maintain this really tight junction between these endothelial cells. So what this does is it allows lipid-soluble molecules can get through this membrane, as well as oxygen, carbon dioxide, a lot of different anesthetic drugs, and alcohol can get through here pretty easily. Water, glucose, different ions can also transport through here, although they're regulated and it takes a little bit longer to get through. But what it does is it protects us from different parts of our blood that may not be filtered out well. It keeps those from entering our brain because we got to really protect the brain. Unfortunately, it also prevents us from getting a lot of antibiotics to our brain because we can't get antibiotics across this barrier. A lot of medications we can't get across that blood-brain barrier. And that wraps up our 4 different ways. So we've got the skull, we've got our meninges, we've got our central cerebrospinal fluid, and we've got our blood-brain barrier.